is that this House do now adjourn. Dr Ben Spencer.
Thank you, Madam Deputy Speaker, and I'm very grateful for having secured this debate. Can I start by congratulating our England football team on a resounding victory today? I'm hoping to have equal success after this adjournment debate is completed. In 2017, Weybridge Community Hospital burnt down in a raging inferno, so intense that local residents sought shelter in St James's Church. Weybridge Community Hospital was a much-loved community hospital, which housed the Church Street and Rowan Tree practices, community nursing, physio and imaging, and a walk-in centre in which people could be seen on the day. But now both practices and community nursing operate out of temporary porta cabins and buildings on the site. Even before the pandemic, they faced challenges, with concerns around their ability to provide the sort of care that they wanted to provide out of porta cabins that are standing there. The pandemic has crystallised those pressures on the staff. Now, they're a great team, and I thank all those who work there day in, day out for the benefit of local residents. But we owe them and local residents better. Now, I visited the porta cabins. There's not enough space, quite simply. Staff work out of rooms without any windows. It's a sight to behold, seeing the working environment, sort of people crouched behind desks with filing files above, below, either side. They need more space for their working environment. It's not a pleasant environment to work in. And the availability of free rooms hampers the amount of clinical activity that they can do. Of course, they have difficulty recruiting. And despite this, they're doing their best. And again, I thank the team working there. But 5 years on, people living and working in Weybridge need permanent healthcare facilities rebuilt, not temporary facilities made permanent. Now, speaking to my residents both on the door and in correspondence, this is a major concern in Weybridge. And it's not purely about the current provision of care, which remains a challenge. Both Church Street and Rowan Tree practices have much larger numbers of patients per GP than the national average. But there's also several housing proposals being mooted for Weybridge. And my constituents already struggle to see a GP or healthcare practitioner. And they're rightly saying to me, look, if the planning authority approves these proposals, it's only going to get worse. We urgently need improvement in our local infrastructure, of which healthcare is a key part of that. So where are we now? Since 2017, there's been much consultation, but progress has been hampered by repeated delays, the pandemic, the complexity of joint working, joint project working, and now, of course, the challenges that we're facing in terms of inflation. Many people loved the walk-in facilities that the community hospital used to have. And of course, there's an understanding that in the post-pandemic world, a walk-in centre, as they used to be, is not possible. But distilling the essence of what the community hospital offered, what it meant to people, is same-day access to care. Whether that advice is from a pharmacist, nurse, member of the extended multidisciplinary team, or speaking to or seeing a GP. I am delighted that in response to my feedback from myself, alongside other key stakeholders, the CCG, now ICS, has confirmed that this is something that they're going to provide. But there's also been much exploration as to how the rebuild could be incorporated into wider town centre development, which would be, of course, a huge benefit to Weybridge. Over the past few years, discussions have included the redevelopment of the Weybridge Library building, development of a super surgery, incentivising active travel, creating a broader community hub. And while the benefit to Weybridge of such improvements is irrefutable, my concern throughout has been the need to prioritise rebuilding of the health facilities which are urgently needed. So while I share the ambition for town centre redevelopment and improvement, I worry that this would delay provision needed today. And I've argued that we need a two-phase approach to the work. Number one, get the permanent health care facilities rebuilt, and then move on to the more general town centre community rebuild, making sure that the rebuilding the health facilities leaves the options open in terms of the town centre redevelopment. Now, many people have been involved in this project over the past 5 years, and I'd like to give my personal thanks to Councillor Tim Oliver, who's both County Councillor for Weybridge and also leader of Surrey County Council. and for his work and leadership driving this forward, both given his role as a county councillor, but also involved in the ICS alongside his work at county. Alongside the NHS team, who I also thank, he has led the work to drive this forward. I'd also like to thank the Way Better Weybridge team working on this and the wider redevelopment project. And in particular, I'd like to give my thanks to David Arnold, who's the chair of the Weybridge Society, and I'm very grateful for his discussions and feedback, alongside all the feedback I've received from our community groups. And I'd like to thank residents for their engagement at community events and for their feedback to me. 5 years after the fire, our GPs, nurses, admin staff are still operating out of these porta cabins, not permanent healthcare facilities in Weybridge. Residents are waiting for appointments, not getting same-day access. Patients are still travelling to St Peter's for physio diagnostics rather than getting it in their community. We're at the point where the work on the detailed plans are underway, but with no agreement reached for sign-off for the funds needed. And this is the crux even of the issue. Now, by way of background, the NHS self-insures, by which it means that in events such as destruction of a building, the money comes out of the funds allocated to the whole NHS estate, which of course makes sense and saves the taxpayer. But there is a drawback to this approach. If one approaches an insurance company after the usual wranglings, they pay out. Where they find the money from, effectively, is not the problem of the person who's putting in the claim, and there's contract and liabilities expectations. Under the self-insurance model, the same contractual arrangements don't exist as you would see in the private sector, and we're waiting for NHS Property to sign the dotted line. I understand that they have offered only a proportion of the money needed for the rebuild in total, not full cost, with ICS, County Council left to make up the difference. Now, not only does this put pressure on my local county council to make up the deficit, but it adds further delay and uncertainty. We already know the pressures health services and local authorities face with increased demand for health and social care. And my residents should not be forced to face cuts in other local services in order to have adequate health services return to Weybridge, if that is the challenge in terms of delivering the money that's needed for the project. So in summary, while local services are doing the best they can, we need this agreed now to provide certainty for residents.
I beg to move that this House do now adjourn.
The question is, this House do now adjourn. Dr Ben Spencer.
Thank you. So in summary, while local services are doing the best they can, we need this agreed now to provide certainty to residents. We need permanent healthcare facilities rebuilt in Weybridge. And I therefore ask the Minister, when responding, to address my concerns regarding the self-insurance model, to confirm that NHSP will cover the cost of the rebuild in entirety, and agree that rebuilding health services in Weybridge is vital and already long overdue. I will continue to work supporting local partners to get permanent healthcare facilities rebuilt in Weybridge, and I want to thank everyone again involved in driving this project forward for all our residents.
Minister Will Quince.
Well, thank you, Madam Deputy Speaker, and firstly let me congratulate my honourable friend for securing this very important debate. And I know that my honourable friend has been a strong advocate for the rebuild of the Weybridge Hospital site, which, as he rightly said, is owned by NHS Property Services, or as I'll refer to it, NHSPS. And I know my honourable friend met the former Secretary of State for Health and Social Care, the Right Honourable Member for Bromsgrove, in July of this year to discuss progress with the rebuilding plans, and ministerial colleagues wrote to him on the 16th of August. And although we have discussed this issue, I think at least once, if not twice, I'm sorry that we have not yet had the chance to formally meet as we originally discussed last month. But I know that Lord Markham, Madam Deputy Speaker, who has ministerial responsibility for NHSPS, will be very happy to do so following this debate. Now, my honourable friend refers to the terrible fire in July of 2017, which resulted in the immediate closure and demolition of the site on safety grounds. Following the fire, the local health system and NHSPS acted quickly to provide alternative accommodation for the provision of services. And as the landlord, NHSPS installed temporary porta cabins on the site, as my honourable friend says, enabling those 2 GP practices, community services and a pharmacy to continue operating. And I know, Madam Deputy Speaker, that my honourable friend, as he points out, and his constituents have been frustrated by the apparent lack of progress in producing a future plan for the site. And I'm aware that re-providing for the services currently housed in Portakabins, with all the difficulties that he so well describes, is an absolute priority for him, and I know for his constituents. And I note that he appreciates it was important for all of the local stakeholders to consider the long-term commissioning requirements and, of course, the associated property needs. And this included exploring the potential of configuring services differently across the centre of Weybridge. And as my honourable friend points out, the previous hospital did not reflect modern healthcare needs, so for example containing things like bedded wards which were no longer in use. This work was led by Surrey County Council, working in collaboration with the other public bodies, and I would like to echo my honourable friend's thanks for the work of council leaders on this project and the Better Weybridge team. The decision was rightly taken that the hospital rebuild should progress first as a standalone project to be delivered by NHSPS, with a capital contribution provided by central budgets, and the standard business case process would be required to demonstrate that the scheme represents value for money, is affordable, and importantly is deliverable. And in April of this year, NHSPS was therefore asked to commence work with the Integrated Care Board, or ICB, to put an indicative business case together. And as my honourable friend points out, good progress has been made in terms of the design, development and pre-application town planning works. And much of the essential detailed preparatory work is therefore well underway, as my honourable friend rightly states. In parallel, the ICB are engaging with key stakeholders and providers to confirm the scope of services to be delivered from a new health campus. And the plans broadly reflect the services previously provided, but with the addition of a mental health hub. The plan also includes a primary care network base, providing a wide range of clinical services to reduce the need to travel to an acute hospital site. And, as my honourable friend rightly points out, vital for local residents, a same-day urgent care access hub, which replaces, as he pointed out, the very popular previous walk-in centre. And I understand the ICB will be holding a further public engagement event in January to provide an update on their plans. Now, with respect to funding the new facility, my honourable friend has raised the issue of the self-insurance model. Now, self-insurance is the model in place for all NHS buildings, as this is considered the lowest overall cost, since the government can pool and spread its own risk, therefore making it cheaper. As my honourable friend, however, rightly points out, this does though mean that when there is a significant loss, like there was at Weybridge, the replacement must be funded from current government spending budgets. Now, due to the local service requirements, the capital asked from central budgets is larger, Madam Deputy Speaker, than comparators for other new community hospitals. And accordingly, it's necessary for the local system and NHSPS to work together to identify additional sources of funding to deliver this scheme. And I'm assured, Madam Deputy Speaker, that good progress is being made on this issue. Now, when my department wrote to my honourable friend on the 16th of August, I know important meetings were taking place involving all of the relevant parties to discuss the current ICB proposals and agree how the new facility will be funded. And the government's recent autumn statement on the 17th of November has maintained our level of capital budgets. However, there are a number of pressures on future capital funding, Madam Deputy Speaker. So, for example, the high levels of construction inflation, and as a result, this scheme will need to be considered alongside other local and national investment priorities. So, Madam Deputy Speaker, I hope that my honourable friend will accept that there are good reasons why it has taken the local health system some time to agree the commissioning requirements for services in Weybridge, but the ICB, local providers and NHSPS are now working collaboratively to deliver a new community hospital in Weybridge, and importantly, the preparatory work is well underway, and as I said, Madam Deputy Speaker, the ICB will be holding a public engagement event on the very latest plans in January next year. Subject to the budget position, the ICB aim is to submit a business case early next year for approval, and following this, it is usually 18 to 24 months, which is normally required, to finalise designs and agree contracts before building works can commence. To conclude, Madam Deputy Speaker, I want to thank my honourable friend for highlighting this hugely important issue this evening. I know that it is one that, on behalf of his constituents, he will campaign on and champion over the coming weeks and months. The new community hospital at Weybridge matters to his Runnymede and Weybridge constituents. It matters to him, and therefore, Madam Deputy Speaker, it matters to me. And I look forward to working with him to deliver this new community hospital at Weybridge.
The question is, this House do now adjourn. As many as are of that opinion say aye.
Aye.
The ayes have it. Order, order.